Good morning, ladies and gentlemen.
Good morning.
How are you feeling today? I can see all of you actually very energetic, isn't it? Semangat, energetic, because today we will have a very, very important and very, very knowledgeable health talk. Alright, so my name is Phyllis. On behalf of MyVantros, I would like to extend a warm welcome to all of you. Okay, and we would like to take this opportunity to congrats our MyVantros first gold diamond, Mr. Kwajoni. He has achieved his gold diamond rank in month of August.
Yeah.
Please give him a big hand.
Thank you.
And of course, we would like to welcome our diamonds. For diamond directors, please sit in front, yeah? Where's my diamond directors? Alright, and also not forgetting our emeralds, our ruby, and our directors. Please give them a big hand. Thank you for taking time off your busy schedules to join us today. We hope you will learn a lot today. We have lined up for you to be fruitful and engaging. Alright? Okay, so ladies and gentlemen, it's a great pleasure for me to introduce our speaker today. Do you know who is our speaker today?
Dr. Ashvin.
Ashvin, because if you didn't mention his name correctly, he won't come up. Alright, again, Doctor? Okay, he's going to talk to us about how IM laser going to improve our health conditions. I believe actually most of us we're having some questions from our prospect, from our customer, isn't it? Sometimes we might not have the correct answer to answer our prospect or our customer. But today, Dr. Ashvin will lead us on this. Alright? Okay, so Dr. Ashvin, he is a medical doctor with MBBS from Malacca Meriwell Medical College. He has more than 11 years of experience. He has served both in government and private medical sectors in Penang. Besides his modern medical practices, Dr. Ashvin is very passionate about functional, preventive, nutritional medicine and total wellness. He is also a strong believer in naturopathic medicine, antioxidant therapy, and photobiomodulation therapy in treating and improving disease outcomes. It is notable that Dr. Ashvin is also a well-known speaker and community projects, health forums, and medical conference. So ladies and gentlemen, please join me in welcome our speaker today, Dr. Ashvin.
Hi.
Hi.
How's everyone doing? Good. So we actually managed to make it despite of the very bad weather that we've all been experiencing in Malaysia lately. Yeah? Okay. So anyway, just want to introduce myself. My name is Ashvin, and I'm actually from Penang. And
louder a bit.
my name is Ashvin. Can you hear me at the back? Can
Not so clear.
My name is Ashvin.
Okay.
Soft spoken lah. Okay, my name is Ashvin and I'm from Penang, and I'm very interested in a lot of preventive medicine. I think we all Malaysians, we love our food, right?
Yeah.
Don't we love our food? And coming from Penang, food is heaven. Yes, a lot of people enjoy their food, and we are spoiled with a lot of different food choices. And also, we tend to be a little bit sedentary with our lifestyle, right? We have to admit, we from the house, we get into the car, and then from the car, we get into the office, and then we sit the whole day. And then when you want to exercise, you kind of feel a bit lazy, and then you want to go back home, spend some time with the family. So it ends up that our number of steps that we walk a day, or how much of exercise we do a day, is also quite limited. So actually, this is what is important in our lifestyle, that we have to kind of practice things in our younger years, so that in our yesteryears we actually have a good, smooth lifestyle. So a lot of things nowadays like high blood pressure, cholesterol, diabetes, cancer are very prevalent, and more so with the 21st century environment that we are experiencing right now. So like things like haze and all these toxins that we have in our food, they all will somehow have some kind of detrimental effect on our health, on the cells in our body. So I'm going to talk to you about something that's quite interesting today. It's actually a little bit involving cellular medicine. Is it clear at the back? Yes. Is it okay? Okay. So after the talk, there will be a Q&A session. If you have any questions or any doubts you want to ask me, please feel free. You can ask me anything pertaining this topic. Okay. So what I'm going to talk about today is photobiomodulation therapy. A big word, but to break it down, what it actually means is photobiomodulation. Photo means light, bio means the cell, and modulation means to change the cell. So the way that medicine is now heading towards is actually trying to alter the internal structure of our body. All this time we are trying to work on the outer part, but actually if we work on the inner part, that's one way to improve our health. So we are using light therapy. What we're going to talk about is using light therapy, using a non-ionizing light therapy. Non-ionizing means this form of light therapy is not harmful to our body. It's not capable of causing any harm to our body. It's a natural form of light that is actually beneficial. It's therapeutic. So when we watch Hollywood movies, we are very familiar with the lasers on top of sharks and people using lasers to shoot each other, Star Wars and things like that. But what we're talking about is a therapeutic laser. It's a beneficial laser that is used in the medical practices. So we have a light spectrum. Light has a spectrum. The full light spectrum is about until 1100. But based on a lot of clinical studies and a lot of research over many years, we have found out that around 650 nanometer it has a very therapeutic, beneficial range to help our body cells. So if you look at this picture over here, this range around this area here is around 650, between 600 to 700, the orange range, which is the near infrared light. So it's a very far spectrum from all the other forms of harmful like X-ray and gamma ray. It's a natural part of visible light. So it's a normal light spectrum. So if you talk about photobiomodulation therapy, what is this thing? How long has it been around for? It's something that is actually very old technology. We all heard of Albert Einstein before? So a very intelligent person in the 1920s, he actually won a Nobel Prize. He won a Nobel Prize for emission light therapy, which is actually the basis of what we're talking about right now. So now it's already 2019, so it's about 100 years from when it was first discovered. But over the years, they have improved and improved on the technology, especially over the past 20 years. And that's how they have found that its medical benefits are very good. So in our body, we have cells. We are all made up of cells. We have about something like about 30 trillion cells in our body. And all these cells, they are made up of different things. Some of the things that they are made up of is something called mitochondria. Like where we get our energy from is the mitochondria. So the mitochondria, the light, this therapeutic range of light, it goes into the cytochrome C inside the mitochondria and then increases something called ATP. ATP is what increases our energy. Human beings, animals, plants, they all have ATP. So ATP is actually something that we derive energy from. So plants, for example, they get their ATP from photosynthesis when they get sunlight. Humans, when we consume carbohydrates, proteins, fats, food, it converts into ATP, and that's how we get energy to conduct our daily activities. So the ATP lies inside the mitochondria, and the photobiomodulation light therapy actually stimulates the ATP production. So it increases the light and the energy within our cells. So that stimulates something else called nitric oxide. Nitric oxide is actually in all our blood vessels. When we are around our 20s, the nitric oxide level is something like about 100%. And we get on to our 30s, 40s, 50s, and 60s. About every 10 years, the nitric oxide level goes down by about 10%. So by the time we hit our 50s, the nitric oxide level is about 30% lower. And that causes hardening of the blood vessel. And that leads to conditions like heart disease, high blood pressure, high cholesterol, and eventually there's less oxygen to all our vital organs, like our brain, which can link to Parkinson's and Alzheimer's, like our heart, that can lead to heart disease, and like our pancreas, that can lead to diabetes, and that our kidneys, that can lead to kidney problems. So actually, a lot of it is actually linked to low oxygenation to these organs. These organs actually survive on oxygen. So they need a lot of oxygen to function properly. So as the years go by, the oxygen to these organs reduce. These organs, the function starts to deteriorate. And then disease starts to set in. Confusing. Pening already. Everyone had breakfast now? Okay. So make it simple. When you use a laser device, if the laser device is therapeutically functional, then it actually can speed up healing and wound repair, and reduce swelling and inflammation, increase blood supply and oxygen to the vital organs, and it can remove toxins. Pollutants, chemicals can be removed from our body, and these are all accumulatively going to be causing disease, including things like cancer. So these are some of the benefits of cold laser therapy. It can increase blood supply, collagen for the skin, the muscles, the bone. It can increase bone formation, so bone can start to repair. It can increase cartilage formation. Nerves can also regenerate, and it can reduce inflammation and edema. Edema is like swelling of the legs or other parts of the body. So this is the process that I explained just now, and that's how it works to repair the cells. So why is this important? Why are we talking about cellular therapy? Because medicine has progressed over so many years. Now people are realizing that it's disease treating is one perspective of medicine, but also preventing disease from setting in the first place is something that is like repairing something and preventing it from happening. Which one would be better, repair or prevent? Repair. Prevent would be better, right? Prevent would be better. We rather prevent something from happening than repair it. So now medicine is going more towards preventive medicine, trying to prevent things before they set in, because once they set in, then you have to start doing the repairing procedure. So Singapore has put in about 80 million Sing into cellular therapy because they find that this is where medicine is heading towards. So cell therapy is non-invasive. It's pain-free. There's no pain involved. Okay? There's no needles poking. There's no knife cutting. There's no surgery involved. You can do it before bedtime. You can do it in your home. It's very convenient. And medication is consuming chemicals. Sometimes we have no choice. We have to consume chemicals for our benefit. When you have a particular disease, you need to consume the chemicals. But whatever we put into our body has some element of drug or some element of chemical inside it. So if you can do something on a natural level which does not have any drug or chemical behind it, it is not artificial, it's natural. So I just want to say that cellular dysfunction, when the cell is not functioning at its optimal level, that's when disease starts to set in. So the cell actually is one of the causative reasons why a lot of disease happens. All sorts of diseases, ranging from almost every single part of the body, starts off from the cell, the building block itself, just like a foundation for a building. If the bricks are not set properly, the building structure is not strong. So it's the same concept. So every cell in our body collectively becomes a tissue, and collectively it will become an organ like a kidney, and then collectively it will become a system, and collectively it will become the whole body. So it all starts from the cell. So now we talk about ATP, the energy source where we get our energy from. So we have about 1,000 to 2,000 mitochondria per cell. That's a lot. And from every single ATP that is in our cell, it can form up to 8 molecules through a process called a Krebs cycle, which is a very good return of interest. One ATP molecule goes through a process in the cell to produce 8 molecules. That's better than any stock market. The return of interest is very high. So this is how a cell looks like. There's a lot of different things going on in the cell, but what we are focusing on is the mitochondria, and that has been linked to anti-aging. So even anti-aging doctors also, they focus on mitochondria. So this is a 3D picture of how the mitochondria looks, and ATP is produced from inside there. So low ATP starts causing cellular problems. The cell function is not optimum anymore. It doesn't work as well as it used to, which is what happens during aging and when disease starts to set in. So we want to keep our ATP high, and that's when we have a lot of antioxidants in our body. Antioxidants are something that is like the good guys in our body. The free radicals are the bad guys that actually encourage and promote disease. So this is how it looks like inside our body. So that's the antioxidant fighting against the free radicals. So we have to keep a good balance between antioxidant and free radicals. Free radicals have to be low, antioxidant have to be high. The more antioxidants we have, the more we can keep on washing out all those toxins and byproducts that can cause a lot of health problems down the line. So free radicals have been linked to aging. The more free radicals we have in our body, faster the aging process, faster the disease starts to kick in. So free radicals are unstable. They are jumping from here, there, they're very unstable. They try to influence other cells. Just like cancer, they keep jumping from one cell to another, and then they keep motivating those cells to destroy other cells. So it gets progressively damaging. So this is a healthy atom, and this is a free radical which starts to steal atoms, making it unstable. So the antioxidant stabilizes the free radical and reduces the aging process, reduces disease. This is not how a free radical looks like, huh? So there becomes damage to the DNA. More free radicals in the body, more damage to the DNA. More damage to the DNA, more result in aging and progressive disease process. So these are the list of all the diseases that are linked to free radical or oxidative stress. Low antioxidants, high free radicals. So you can see in the eyes, the lungs, the blood vessel, immune system, the joints, the organs, the skin, kidney, heart, and even the brain. So many diseases that are linked to free radical damage. So these are the common factors in our day-to-day that is going to cause free radical damage. Food. Who doesn't like McDonald's here? KFC, Pizza Hut, Domino's. So these are now all the foods that we didn't have like about 100 years ago, right? We are prone to fast lifestyle, call up, okay, got Grab delivery, and got all this food delivery, Food Panda, everything, just sit at your home, watch TV, then the food comes to the house. So the convenience is there. But that is also creating a problem. The food quality is different. The food is usually processed food. They are made in a different manner compared to the home-cooked food. When you eat at home, when you cook the food at home, you know what oils you're using, you know what is going into the food. The process is totally different. So food is one of the factors. Smoking, pollution, stress, a very sedentary lifestyle, and lack of sleep. a lot of people face sleep issues nowadays because we have a lot of artificial light from the handphones, from the TV, from the tablets, and then the quality of sleep is affected, so we don't sleep so well. In the olden days, the night, when it becomes night, everything is dark. When it becomes dark, we start producing a hormone called melatonin. Automatically, we start feeling drowsy, we go to sleep. Now it becomes night, we on the light, we on the TV, play the handphone, WhatsApp, Facebook, message, Twitter, Instagram, and then until 12 o'clock, 1 o'clock, okay, put the phone away, want to go to sleep, the mind is still very alert because a lot of artificial light is going inside. And this artificial light is actually reducing our sleep hormone. So over time, our sleep hormone starts to get less and people start to have difficulty sleeping. But if somebody works in a factory, the factory runs 24 hours, 7 days a week, 365 days a year, the factory is going to break down, isn't it? Factory can only run for so many hours, has to take downtime also. So our body also needs downtime. Our downtime is when we actually rest, when our body can detox. All our organs can detox. So sleep is the time when our body gets to detox. So we need to go to bed by around 11 o'clock. 11 o'clock, the detox process starts to occur until about 3, 4, 5 o'clock in the morning. So we should be in bed by at least 11 o'clock. So this is what we want. We want high antioxidants, low free radicals, and we want ATP. ATP will help to reduce the free radicals. So cold laser therapy can reduce the amount of free radicals in the body, increase the ATP, increase the oxygen to these organs. Big difference, huh? Who wants to live to 100 years after seeing this picture? So this is what we see on the outside. We see the physical changes, the changes in the skin, the changes in the hair, the nails, the texture. This is what we can visibly see. But can we see internally what is going on in our body? We can't. So we don't actually know, but this is what is happening on a cellular level. When the cells start to change, then it starts to change the appearance on the outside. So this is what happens in the aging process. So we have to change from within. This is just like this. This apple is exposed to oxidation stress. So you can see the difference between the left and the right side. Thank you very much.
Thank you, Dr. Ashvin, for his interesting talk. So now we're going for the Q&A session. For anyone who having some question, you can stand in front of the mic to ask your question. Anyone would like to start first? Any questions? Any problems with the IM? Yes? Yeah. Gentlemen?
My name is Lee Sing-Yuan, engineer. My question, Dr. Ashvin, is this. How does the cold laser therapy increase blood circulation, especially carrying oxygen to the brain? Very often I feel groggy and all that, and I suspect that is lack of oxygen going to the brain. So my interest is this. How does the CL therapy improve blood circulation, especially bringing more oxygen to the brain?
Thank you. It works based on the ATP increasing something called nitric oxide. And nitric oxide is in all our blood vessels. And the blood vessels, from being very small and constricted, they open up. When the blood vessel opens up, the nitric oxide is in one layer of the blood vessel, which is like a rubber band. It can expand and it can shrink accordingly. So when we have more nitric oxide, we can actually expand the blood vessel more, and the supply of blood is more, just like a pipe. If you squeeze a pipe, then the water flow is not good. But if you open up the pipe, the flow is better. So the nitric oxide is the one that is the controller for the amount of oxygen, the dilatation and constriction of the blood vessel. So cold laser actually increases nitric oxide, which will dilate the blood vessel, increase the oxygen to the brain or other parts of the body.
Hi, morning. My name is Jackie. Could the doctor please explain how this device can help with our body, on the 3 types of therapy? Because I think that will dispel a lot of, misinformation or information that is not aware to us, how exactly the device works.
So the difference, thank you. The difference between a lot of the cold therapy devices, cold therapy has been around commercially available maybe for about 20 years now already. But the machines used to be very big machines. They used to be about the size of a table, that kind of thing. They're about 15 to 20,000 ringgit per machine. Very expensive, very complicated to use. Now they are like dinosaurs compared to what we are using right now. So how it works is, for ion laser specifically, it will work through cold laser therapy, it will work through acupuncture, and through magnet. 3 concepts. But the magnet part, compared to conventional acupuncture, the acupuncture part compared to conventional acupuncture, the acupuncture combined with cold laser therapy is actually 50 times more powerful. So the acupuncture is a very concentrated point. I didn't go into the acupuncture part just now. I was talking more about the cold laser, but in our body we have these meridians. So meridians are actually channels, they are gateways in our body. Indian medicine will call it chakras, Chinese medicine will call it qi. So we have all this energy pathways in our body, and that's how acupuncture works to stimulate these meridians, about 12 to 14 meridians, about 361 to 2,000 acupuncture points in our body. So cold laser, this concept is on the new one point. New one point is on the wrist, and that's how it works to stimulate the chi, channel the energy, and go through these pathways. The cold laser therapy is how I explained just now. Working through the mitochondria, it helps to increase the oxygenation and will help to reduce the stress levels in our body, start to repair and alter the cells using a light therapy, which is therapeutic and not dangerous. The magnet concept, the magnet is a medical grade magnet. The medical grade magnet is actually working throughout the time, even when the device is not on, and that will increase oxygenation. Magnets have been around for many years. Even some people say even up to about 2,000 years. Magnet is a very old technology, and in Japan it's very popular. People wear bracelets using magnet and things like that to increase their blood circulation. Magnet has an ability to change the hemoglobin structure, which causes us to have better oxygen carrying capacity in our body. So it's actually combination therapy, integrated therapy, using cold laser, using magnet therapy, using acupuncture. All 3 combined in one.
Good morning, Doctor.
Good morning.
Yeah. Yesterday, just a question. Yesterday, I watched one video, and that video talked about cholesterol, saying that it is good to have high cholesterol. This is a controversy, so I would like to understand a little bit more why. Because this device is going to lower down our cholesterol level. So what is your point of view about this? Thank you.
Thank you. Cholesterol is actually quite a complex topic on its own, because there are so many different types of cholesterol. There's the total cholesterol, the triglycerides, the LDL, the HDL, and there's the VLDLs. So cholesterol on its own is a little bit complex on its the whole story about cholesterol. My take on cholesterol is that you only need to worry about 2 components. The triglyceride shouldn't be more than 1.7, and the HDL should be more than 1. So the HDL is the good cholesterol. H for Holiao, you just remember, good cholesterol. So triglyceride, not good. So triglyceride, keep it low, less than 1.7. I've done some research in Japan. They've conducted large studies. The LDL is not so significant, especially after the age of 50. In fact, people who live more than people who have a longer lifespan actually have a higher LDL. Most of the time we are taught that LDL is the bad cholesterol and that we should keep our LDLs low, but actually some amount of cholesterol is necessary in our body. So cholesterol is actually important for us to function, to survive. Our brain, about 70% of our brain is made of cholesterol. So cholesterol is a very important thing that we need to maintain at particular levels. So how the laser device works is because it works on the blood vessels. When it works on the blood vessels are clogged up. As we get older and older, just like the filter in the car, it gets clogged up and you have to change your filter. But we can't change our blood vessels in our body. So we have to detox our blood vessels and clear up the atherosclerosis or the plaques, these clogged up yellow plaques that are stuck in the blood vessels in different parts that cause the artery to harden and stiffen, are actually essentially made up of cholesterol. So once we can use something to wash away this cholesterol from our system, the arteries are less blocked up. And when they are less blocked up, cholesterol levels go down, blood flow is better, and then the risk of getting things like stroke, heart disease will be reduced.
Dr. Ashvin, that was a very nice talk. And I just want to know whether any studies have been done, like for the last 5 years, how long has this been in the market? Has there been any studies? So many people were okay, so many people use the system. And what were the things, like for example, did the blood sugar go down? Did the irritable bowel syndrome get better? Did the neurological, what are the effects? I mean, has there been any study that is done so that, we can always say, hey, look, 100 people tried this out so many years ago, this is what happened. Is there any studies done, actually?
So, in the past about 15 years or so, there has been a book that is on all the photobiomodulation clinical studies. A very thick book. It'll give you a bit of a headache to read the whole book, but it's a very interesting book. And you have about 400 pages of clinical studies from all sorts of health conditions, not only in medical, also in dentistry. Very, very big book. It's like, it's like, I think about maybe easily about 70 to 80 chapters in the book. So you have all the clinical studies there about how laser therapy clinically proven to help in different diseases in alphabetical order according to what clinical condition it is. So you can get a hold of that book. It's available online. You can buy it online and you can read the book. So that book has all the, if you're into the scientific part of it and the more in-depth part about how it works, the details, it tells you all the different types of lasers. There are a few different types of lasers. It tells you the explanation behind it, the details about it, and like you said, the clinical studies of people actually undergoing clinical studies and the benefits that they have derived from it. And a lot of interesting, it's a bit too lengthy to talk about it right now, but if you have the time to go through the book, you can read up specifically on which topic you're interested in, and it will give you detailed explanation about the clinical benefit of the laser in each health condition.
What's the name of the book?
Photobiomodulation Therapy, yeah.
Good morning. I just want to check, how about for this cold laser, can you use for the cancer stage 4 or cancer patient or type of cancer?
So, because it has a detox component, these laser devices have a detox component. They're actually clearing out. Cancer itself is also triggered by free radicals. But cancer is a multifactorial condition. So multifactorial means there's a lot of different factors that cause cancer. It's not just one particular thing. So cancer is not very straightforward to treat. It's quite complex, quite difficult to treat, and especially late stage, stage 3, stage 4 cancer is not very straightforward to treat. So you need to also do a multi-approach to treat the cancer. That means based on the person's age, the condition of their health, how much they can tolerate, and all these factors put together, their nutritional status and all that. You have to see whether they can handle the treatment, because like we all know, chemotherapy, radiotherapy, they may have some side effects on some patients, even though they're beneficial, but the patient has to be healthy enough to handle the treatment. So in late stage cancer, it can be used as an adjunct therapy. Adjunct therapy means in tandem with other treatments to detox the cells, to reduce the free radical load in the body, to increase the antioxidant potential, which will help, like the slide I showed you of the molecules that are not stable. So it will actually stabilize those free radical atoms. But whether or not it's beneficial for late stage cancer is individual basis. They can definitely use it, but the patient's outcome is also dependent on what level they're starting. Of course, results with a patient in earlier stage cancer might be more beneficial than patients with late stage cancer. Just as any treatment, the earlier treatment starts for cancer, the outcome is always better. But it's definitely not harmful for cancer patients to use cold laser therapy.
Dr. Ashvin,
Yeah.
what is its effects on the immune system? Cold laser on immune system.
So our immune system is controlled by a lot of things. Actually, our digestive system is where a lot of our immune system is from. So we have different organs in our body, and the organs like the liver and the kidneys are actually the ones that are excretory organs. They are the ones that catch all the toxins that we consume in our environment, and they clear them out. So these organs are actually facilitated when you use a cold laser device. It will actually help to detox the system, to clean out all these toxins, and that helps to boost up the immune system. Also, it increases oxygen to vital organs like the heart and the brain. So when the heart and the brain, they end up getting more oxygenation, their function is better. So that's mainly one of the purposes how it works.
Hello, Dr. Ashwin. Can I ask can this cold laser therapy boost up the production of nucleotide?
In what kind of situation?
Because I understand that everything starts from the cell, and inside the cell is actually the nucleotide. So can it actually help to boost up the production, or do we have to supplement nucleotide with this cold laser therapy?
For what purpose to boost up the nucleotide?
Anti-aging.
Anti-aging, okay. The laser device will work on all the inflammatory cytokines, chemokines, bradykinins, interleukins, all these individual components that we have that cause inflammation. And inflammation essentially is what is going to increase the potential for aging. So it actually helps to reduce all these components, which will help definitely to slow down the aging process.
So does supplementing the nucleotide essential for, together with the use of this cold laser?
Indirectly, it will help to work with the nucleotides, yes.
Thanks. Okay, my question is, does this equipment work for vertigo, as they say? I went through your leaflet. I don't see any mention of it working on vertigo. It does.
Yes, I think there are some testimonials of patients who have vertigo who have used the laser device and got good results with it. Vertigo is caused by different reasons. If the vertigo is caused mostly by ENT cause, it is something to do with blood circulation to the ear, the middle part of the ear. So that is also linked, the laser device increases blood supply to different organs, including the ear. So some patients have even gone to the extent of using the nose piece and putting it in the ear to give direct therapy there. and some have used it in the nose because the nose piece is the one that benefits the facial organs. So depending on the cause of what the vertigo is, majority of vertigo is ENT linked, and if it's BPPV, benign proximal positional vertigo, then usually it should give a good result if it's related to blood circulation.
I see. So it works whether what type of vertigo. I didn't know. I thought vertigo is from the ear only.
Vertigo can also be from the brain. Brain can also cause vertigo. So
The imbalance.
yes, the vertigo can be either from the ear or from the brain. And there are a few other causes, including nutritional imbalance, hormonal imbalance.
But this thing works on any type of vertigo?
Not any type of vertigo. You need to know what the cause of the vertigo is. For example, if the vertigo is caused by a tumor, then if the tumor requires surgical treatment, then you need to do surgery to resolve the vertigo.
But if you, under ordinary circumstances, can you sort of use the equipment and it tells you where you are getting the vertigo from?
Use the device to find out where the vertigo is from.
Yeah.
We are I think they are in the process of coming up with something like that. So they actually, the company.
There are so many areas where it could cause the vertigo.
Yeah.
So if you buy the equipment, would it, you try to use it, okay, on your ear or on your nose, or will it then show you where exactly you'll be having it? Does it show?
So the Vantros company is actually working on artificial intelligence device that will be able to in the future diagnose where the health problem is linked and where is the causative organ and what you need to do about it to actually improve your health. For the time being, you need to go to see your doctor to diagnose. He will need to do his investigations, take a history.
What is ENT? So this
ENT, if the ENT is, like I said, BPPV, ENT can also be a tumor, and if it's BPPV, it should help. BPPV, yeah, that is the most commonest cause of vertigo. Yeah.
I can't understand still. That's my problem, see?
Hi, morning.
My name is Elaine. Okay, I'd like to ask a question concerning thalassemia trait. Because I understand that thalassemia trait people, normally their blood shape is not the donut shape. So basically the oxygen level in the body is lesser. So would this device actually improve people with thalassemia trait conditions?
It should help to improve on the concept of cold laser by increasing the nitric oxide and improving the blood vessels opening. It should work also on the acupuncture, which also helps on the blood vessels, increasing blood supply, as well as the magnet. The magnet also helps to increase the blood viscosity, oxygen carrying capacity, which is necessary in thalassemia because thalassemia commonly face the tiredness and fatigue. It's a very common problem for thalassemia patients. So it should help to work on that using 3 different modalities to increase their oxygen carrying capacity.
Can I also ask a second question is that assuming the person has pre-diagnosis of cancer, let's say the person doesn't know that he has cancer in the body. So basically, if the person uses this device, would it actually neutralize the pH of the body? I mean, less acidity, making it more alkaline, something like that.
From my knowledge, specifically working on alkalinity, possibly no, but on working on other aspects to prevent cancer in the sense of the free radical damage. Every day we are exposed to toxins, and everyone has some amount of cancer cells in their body, but whether those cancer cells actually get activated or not is the question. So if those cancer cells can actually be detoxed out of the body on a regular basis, either through exercise or through regular bowel movement, good sleep quality. All these factors, they all play a role in us reducing our cancer load in our body. That's why people who are constipated, have high stress, and a few other factors are more prone to getting cancer. So this actually helps to detox and purge out the body from all these toxins. And that, of course, along with drinking water, because when you hydrate, these toxins have a way to eliminate out of the system. And that's how it will help to reduce the free radical load that is linked to cancer.
Thank you for answering
Thank you.
the questions.
Can pregnant women use the cold laser?
So because our technology is based on clinical studies and on science, just like many drugs also in the market, there's insufficient evidence to say that it's 100% safe in pregnancy, but there has not been any reported risk so far of pregnant women using it and having any adverse effects, or lactation, breastfeeding, using it and having any adverse effects. There's no science to prove that it's dangerous, but there may not be sufficient clinical evidence yet to prove that it's 100% safe. But generally, on general speaking terms, it shouldn't be dangerous. But if you want to be more on the precautionary side, you could consider to avoid during pregnancy and use back after delivery. Yeah.
Okay. Doctor, my name is Cindy. I have 4 questions. I'm a current user. I've used it for 3.5 weeks. And the purpose of us buying this device, or bought this device, is for 2 things. One was to help increase the sleep quality, and second was to see if we can manage the sugar level. So the first question is relating to sleep quality. What I observed the first 3 weeks, fantastic sleep, not waking up middle of the night. But in the last week, the old pattern occurred. So I would wake up 2:30, 3 o'clock in the morning. So I'm curious how it actually works and what's actually happening, because I haven't changed my diet so much, activities quite similar. So that's the first question. Can you help me share some insights on that?
So, how are you using it? Are you using it just on the wrist? Are you using it on
Wrist and nose,
wrist and
as
nose?
recommended,
Okay.
twice a day,
Twice a
morning,
day.
evening, before bed.
Okay. So generally, in any detox process, if you've been through any detox process in the past, for example, people do juicing. They take juice, or they drink alkaline water, apple cider vinegar, lemon. So all these detox processes, there's a little bit of an up and down kind of a period sometimes in the initial phase, because your body has to clear off these toxins from your system. So you might get consistent results, and then sometimes it might change a little bit, and then it might get better after that. So importantly is just be continuous in using the device twice a day with the nose piece, especially because the nose piece is what is going to benefit, especially for sleep. What you could do is try to maybe avoid using just before bedtime. Some people are a little bit sensitive when it comes for sleep, so maybe try by 5 o'clock to use the second time, and avoid using it just before bedtime. If you feel that might make a difference, you can observe and see if that works for you. So that could be one of the reasons.
Thank you. Second question is relating to managing glucose level. So since I started, I test my glucose twice a day, and I noticed there's a fluctuation, so it hasn't changed so much. So can I expect that it may change, and how long does it take?
I would say the safe period of time to see any beneficial change, you would need to give it at least about 90 days, at least 3 months. Of course, you need to do your diet control and your regular exercise, and these factors will also help to bring down your sugar levels. But a lot of testimonies of people who have used it for diabetes and got very good results before and after. Consistency is the key. You have to be consistent using it, and you have to give it a few months to start seeing it. But monitor closely, monitor the sugar levels, and see the improvement before and after.
Right. So in terms of uses, it's still the standard setting, the 3 bar morning and evening?
Correct. 3 bar morning and evening, that's right.
Yeah. Because my question is related, which is there a need to stop its use after a certain period of time? Like certain vitamins that we take, we've got to stop and let our body kind of adjust to it?
So far, not regarding cold laser therapy. You can continuously use it on a day-to-day basis without having any worry about that.
Okay, so the last question is, I'm curious, because my upline says you use this gadget in your practice. So I'm curious to hear stories of how you actually use it with your clients.
So I have a lot of patients that have got benefit from it, from nerve problems, muscular problems, diabetic patients, cholesterol patients, patients with sleep problems, low energy problems. So quite a range of patients who have used it for. If the clinical study book, if you're interested in looking at that, there's a lot of benefits. But right now, I've seen benefits in various different aspects of it.
Yeah, because you mentioned that book. That's a generic book on cold laser therapy. I'm more interested in Vantros studies on this particular device rather than the generic technology studies.
So if you want specific testimonials to Vantros, you can check with the company. They have a whole list of all the testimonials.
I've seen the testimonials. It's more the scientific studies, like how they do trial studies. Are there any such thing relating to this product?
Clinical trials? Yes. In the works. In the works.
Thank you.
Okay, good morning, Dr. Ashvin.
Morning.
Good to see you again from Penang GH.
Yeah, good to see you.
Yeah, all right, so I'm also in the medical line, and I've treated many patients using anti-free radical therapy. And definitely it works for diabetes, hypertension and everything. But I have a problem in treating pain. So I see that there's a pain management therapy here, right? Okay, so I just want to ask your experience, how long you've been using it for patients?
Close to about 6 months.
Okay.
Yeah.
Okay, so there's a lot of pain, I mean for the benefit of the crowd here, there's a lot of pain management these days that medicine don't seem to treat, Simple things like slip days, and it caused by various forms of inflammation. And I've come across patients these days with fibromyalgia. Fibromyalgia, for those of you who are not very sure, is a new disease, and the cause for it is not very sure, but patients suffer from intense pain throughout the body. Just want to ask your experience, have you come across any of these cases in terms of pain management therapy? Does it help? And also, maybe later you can share me how exactly to use it, all right? And the other thing is, most of my products that I use to treat, besides medicine, is consumables. So this is a wearable, so it makes a huge difference there. Have you come across any adverse effects so far? I don't think so, but if you have this experience, let me know. Thank you.
Thank you. I have a patient who has back problems, and that is related to a spine problem. So I've used it for that patient and got good results with it. It's also involved with something called sciatica. So the sciatic nerve involvement, and it had targeted therapy. That means you use it directly at the site where the location is, as well as using it at least twice a day on the wrist and with the nose. Within about 2 weeks, the pain score from around 7 out of 10 has been reduced to about 3 out of 10. And then subsequently another 2 weeks and the pain score went down to 0 out of 10. So that was pretty good results with the sciatica patient. For fibromyalgia, I don't see that many fibromyalgia patients. It's not such a common condition to see and to diagnose in the first place, but there are some patients who have used it and they have generally got more energy, improved sleep and more energy. Complete reduction of pain, fibromyalgia is also linked to the way the brain interprets the pain. So on that kind of pathway, it might have a beneficial effect to reduce it. Yeah.
Ashvin.
Hello.
Will this device help children with learning disabilities? Because like autism, I'm blessed with Down syndrome. He's 28 years old. So will this device help Down syndrome? Because basically they have this hypertonia body, the muscles are, and then their speech is, they don't have a very clear speech. My son stutters. So will this device help? Basically, I came to find out more about, how will this device help my son plus other children with autism, cerebral palsy? Because I'm actually involved with this community, parents who are having so much problems, autism, cerebral palsy, dyslexia. Will this help ADHD? So will this device help them? And also you mentioned that you're not sure whether it'll help during pregnancy, but how about the newborn babies? Will this device help, that there's something not right, like autism is just detected after a few years or sometimes 3 years later when the child doesn't utter a word. So at that time, whether it's okay to use this machine, will it have any side effects? Because you mentioned that pregnant mothers, whether it's okay to use. I'm not sure, sorry if I missed, but whether it's okay to use during pregnancy. But the newborns, it's written, I think, in the pamphlet that newborn babies also can use. Please, I really want to use this device from my side, if it's going to help. Thanks.
Sorry, just now I was asked about any adverse effects. So far to note, I have not noticed any adverse effects of the... Sometimes there's a little bit of a healing crisis. As the toxins are being cleared out, people have very high toxin load. If they go for the full spectrum of the treatment, they may have to titrate down a little bit initially for their body to adapt, and they may experience maybe some slight dizziness or slight headaches initially as the toxins are clearing out, which is very normal in any form of a detox process, but it usually clears off. In terms of newborns, yes, there are newborns who have used it without any side effects or any adverse effects. Actually, the age spectrum is 0 to 120. So, so far, there have not been any reported adverse effects or side effects of using the device. So there is no harm. It's more a question of whether the child actually needs to use it specifically for any health condition, or you may want to use it at a lower dosage to start off it slower because of the body size being smaller. Was that the question? Down syndrome. Okay, so Down syndrome. So Down syndrome, autism, ADHD, all are different causes of each. They can be either genetic, and genetic is something that is in the DNA, which is already inherent. So how much to change the inherent changes in the genetic DNA is obviously going to be very difficult. But you can manage the symptoms of it. You can reduce the symptoms of it if, for example, there are motor symptoms involved. There are actually very good results with people who have motor dyskinesia. That means they have some kind of condition where their muscles and their nerves are not working in tandem together. And they have got good results with this group of patients. And Down syndrome, they might see some motor changes in the patients. Autism and ADHD also different causative factors. It could be due to sometimes nutritional deficiency like vitamin D and other factors as well. And sometimes it can be toxin overload. If there's excess amount of toxins in the system, sometimes the detox component is also very important. They have noticed that these children sometimes have a higher load of heavy metal toxicity in their body. So sometimes the detox process, this can definitely aid. There's a condition called chelation, which some doctors use. So this is also a form of chelation therapy that can help to detox the body out, reduce the toxin load. And there are patients who have autism and ADHD who have used it and got good results.
Is there any testimonies like I want to hear MyVantros testimonies where this has helped?
Personally, for me, for autism, ADHD, and Down syndrome, I have not used it for those patients. But I'm not sure if anybody has specifically got any benefit with these patients. You can check with the company.
Can I ask, on behalf of somebody who's suffering from AS, spondylitis, it started to spread to her arms, and she's wondering whether this will help. The other experience some people have went through is extreme dizziness and numbness in the legs subsequently and so forth. Yeah, and another patient has got a sudden spike in blood pressure, and they panic and they stop using. So hopefully you can help to address these symptoms.
So for AS, ankylosing spondylitis or bamboo spine, is autoimmune condition. So there are a lot of testimonies of people with autoimmune conditions using it because of the immune system effect that it has to reduce those inflammatory markers that cause the inflammation that trigger off the autoimmune condition. So it can be used by these patients to improve their pain symptoms and their discomfort symptoms, but they will have to use it with the nose piece to get the maximal benefit because it will have to work on the brain. But with in situations which involve autoimmune conditions, I always recommend to start slow and slowly build up accordingly. So don't start off with 3 bar, they can start off with a lower 1 bar, then 2, then 3, slowly build up so that the detox process is on a slower level and they can adjust better. Blood pressure also, good testimonies with blood pressure. Patients have used it and they have actually got good results. Of course, again, along with the lifestyle change.
But in this case, elderly patient had a very sudden spike and subsequently was admitted for thorough checkup. They got frightened, they stopped using. And then, yeah, of course, there's some cascading side effects from certain medication for rash that surface and things like that. So they're asking for advice, should they continue, they're afraid to use, yeah, things like that. Yeah, and then the other part is quite a number of patients do have dizziness is common, you know, after using this, and they got frightened again and they stopped using. Some very extreme dizziness as well. Yeah.
So all these are part and parcel of the healing crisis, which is normal in a detox process. Or sometimes, for example, when somebody starts taking blood pressure medicine or diabetic medicine, their blood sugars and their pressure is already adjusted to a certain level. So when we try to bring it down too drastically, they feel very uncomfortable. Even though the medication is for their benefit, they actually don't feel good with the medication initially because the body has already adapted to a different sugar level or different blood pressure level because of their health condition. So this is an adaptation mechanism which usually just has to be reduced the dosage and then slowly allow the body to get adjusted to it. Don't have to start. Some people are more sensitive than others. A lot of people take 4 bar the first time they use it 5 times a day and they have no symptoms. But some people who are more sensitive or may have a higher toxin load in their body, they may take a little bit more time to get adapted to it. But they should continue going back to it. Try to find out what the cause of the pressure shooting up is. There may be some other reason for that.
Thank you. Can I ask one more question for patient with thyroxine situation? Thyroid, rather hypo or hyper kind of situation. Is this suitable? Because there's some write-ups that says that it is not advisable for people with thyroid situation to use it, but we don't know. If you can highlight that, I appreciate it.
Again, there are testimonies of people with Graves' disease and hyperthyroidism, Hashimoto's condition who have used the laser device and got good results with it. But it's not recommended to use the laser device directly on the neck because of the stimulatory effect that it may have on the thyroid gland. So to use it on the wrist, but not targeted therapy at the thyroid itself, should not have any adverse effects.
My name is Heng San. You mentioned earlier that you have used this cold therapy for the treatment of or the relief of pain in sciatica. May I know the mechanism with which it works? And the second question is, when the relief of pain has been achieved, does the pain come back, or you have to use this therapy continuously?
Thank you. So mechanism of how it works is we have pain cells, we have pain receptors, we have inflammatory cells. So these inflammatory cells are usually located at the site of where the pain is originating from. So this actually helps to reduce the receptors or the pain fibers at that area by working on the brain and working localized at that area itself. It actually helps to some amount the regeneration of the nerve and also to reduce the pain fibers at that site. So that's how it will help in reducing the pain. And what was the other question?
My second question was, if the pain is
okay, so whether you need to use it for long term. So you can stop using it, but there may be a possibility that pain may come back again depending on what the underlying cause of the pain is. So if the underlying cause is a structural cause, is due to a slip disc or something like that, it may be a temporary relief if the actual cause is not addressed with some work with the physiotherapist or the chiropractor or some other therapy alongside the laser device. But if it's purely just a pain-related symptom, then they may be progressed even if you don't continue using it.
Hi, Doctor. Can you tell me if this will help to deal with people with sweaty palm and sweaty feet problem?
So, sweaty palm, sweaty feet, you're referring to as hyperhidrosis. So, hyperhidrosis, quite a difficult condition to treat. And I have not come across testimonials of people using it for hyperhidrosis, but it's not going to worsen the condition. So you can definitely try, give it a go and see if it's going to help out. It will also depend on what the cause of hyperhidrosis is. Hyperhidrosis can be caused by a few different things. So hyperhidrosis can be caused by chemical imbalances in the body, hormonal imbalances in the body, the lymphatic circulation is affected, and the sweat gland itself is overproducing too much of sweat. So
Hereditary?
Hereditary, I'm not sure. I don't think there's a hereditary component to it, but hyperhidrosis, you would need to find out what is the underlying cause. Sometimes anxiety itself or hormonal problems can be one of the causes. A lot of times hyperhidrosis is treated more with like botulinum, Botox injections, or sometimes surgery.
Okay, so the answer is I can try.
You can try.
But there's no known. Okay.
Not that I know of, yeah.
Right. Thank you.
Doctor, I have two questions. First question is, can we continue 365 days using this and continue many years using this non-stop? Any side effect or because our body lazy to work already? First question.
Okay, so definitely safe to use. It's been around for long enough to know that there's no adverse effect using it for a long period of time. It's in a therapeutic range of light that has no known side effect. So it's very safe. So you can use it day in, day out, every day for long periods of time without having to have any fear, few years, and there shouldn't be anything to worry about. Yeah.
Okay, second one I want to ask is, just ask my curiosity. I saw one exactly the same, different brand with 10 lights.
Okay.
And it's from Penang, so and the price is half of it. So it's not MLM. So Beside our company and few other companies, is it outside got like this type of product?
If you're asking if there are other products using photobiomodulation therapy, there are other products which are using photobiomodulation therapy, but the effectiveness of the wavelength of the light and how effective the light is using a GA-AIA 3R laser, which is the coherence, the divergence, has been clinically studied and medically proven to be therapeutically beneficial, and the efficacy of it is about 90% compared to most of the other brands, which are about 50%. Yeah.
Hi doctor, I have a friend who has suffered from eczema. So she went to see a specialist, and the doctor gave her the steroid cream, and she's taking steroid also. Can she use the watch? How can she use if she want to use with the steroid together? Putting the steroid, yeah.
Yeah, she can use it for the eczema by applying it on her wrist and using the nose piece. So use it both in tandem, at least 2, maybe even 3 times a day.
Will it have any side effect? Because now she's also using taking steroid, and she's using the watch. Will there be a side effect? And now her neck is swollen, the side effect of the steroid.
There shouldn't be any side effect unless she has immunosuppression, if her immunity is suppressed. So using steroids for long term can cause immunosuppression, but if she's only been using the steroids for a short term period of time, there shouldn't be any adverse effects, and ask her to start slow and then slowly build up.
Okay, thank you.
Yeah.
Hi, it's me again. This question is asked on behalf of my friend, who's a bit too shy to come up. She wants to know if a person has got a stent in the heart, can the person use this gadget?
Yes.
With stent?
Yes, pacemakers, stents can use the device. Yeah. Safe.
Definitely.
Safe, yes.
100%.
Safe, yes.
Thank you.
Hi, Dr. Ashvin. My daughter is 19 years old and she has endometriosis. My daughter is 19 years old and she has endometriosis. She has a lot of pain come the period. Okay. My question is this effective for endometriosis, and is there any testimony? And also, my worry is that if I were to use this, will it make it worse? Because it's already spread to the pelvic area, the bowel system. So my concern is that if it spreads further, she might have to go for surgery. And my second question is this: if you have a titanium plate here, and it's the wrist that is very stiff, can it be used on that area? Thank you.
Thank you. For endometriosis, I don't have any personal testimonies of the condition completely resolving the endometriosis, because essentially late stage endometriosis is essentially going to be surgical management. The endometriosis is this tissue that is growing outside the uterus and causing the symptoms of the pelvic inflammatory pain, and without removing the tissue, it's going to be difficult to treat the condition. So this would be based on what the gynecologist says in terms of how advanced the disease is. But in terms of your question of whether it's going to worsen, it won't worsen the condition. So she can try it and see if she wants to try a non-surgical approach. It should help to reduce the pain symptoms, but essentially the pain symptoms are not only going to come from the pain fibers, but they're also going to be coming from the endometriosis per se. So if the endometriosis is not removed, there may be no guarantee that the symptoms may be permanently resolved.
But if you are taking a hormonal pill, can it go along with it?
You can take a hormonal pill, no problem. You can take a hormonal pill and use the laser device in tandem. And a person who has an implant metal implant, they can use the device. But yes, they can use the device. But if they feel any discomfort or pain, they can switch over to the other hand.